How do you use supplements for sleep in your practice strategically with your patients? Let's talk about this. We're going to talk about how to think about using different kinds of supplements with patients and just a framework that you can use to be more strategic with your use of supplements. I'm Dr. Nishi Bhopal, I'm an integrative psychiatrist and a sleep medicine physician. This channel is all about clinical sleep medicine tips for you as the physician, therapist, or other healthcare practitioner. Most of us as doctors only get about 2 hours of sleep education in med school, but 100% of our patients have to sleep. We're talking about how to think about using supplements more strategically for your patients. This is an important topic because so many patients are taking them, but just because something is over the counter or it's natural or it's a supplement, it doesn't mean that it's without risks. There may be contraindications or negative side effects. There can also be interactions with other medications that they're taking. For example, rhodiola may cause increased activation in patients who are taking SSRIs, and I've actually seen this happen in my practice. One of the other risks is that patients might start taking a supplement in place of actually getting treatment. For example, if they're dealing with chronic insomnia, they may start taking melatonin, hoping that's going to take care of the problem, or they may forego doing a sleep study to test for underlying sleep disordered breathing, and they may rely on supplements instead. So it's really important that we as the physicians and healthcare practitioners know how to talk to our patients about supplements and that we have a strategy to use them effectively. In fact, in 2020, the American Medical Association, the AMA, came out with a statement saying that physicians should inquire about their patients' use of dietary supplements, and they should engage in risk-based conversations with them about their dietary supplement use. If you want to learn more about 5 specific sleep supplements that your patients may be taking and that you can consider using in your clinical practice, sign up for my free Sleep Supplements Masterclass. We're going to talk about 5 specific sleep supplements, the evidence behind them, indications, contraindications, dosing, and other considerations. It's totally free. At the time of this recording, the Supplement Masterclass is going to be happening on June 4th, June 5th, and June 12th, 2024. There's 3 different dates and times to choose from. It's the same class, so you can pick the time that works for you. I'll put the link on the screen here and then in the video description below. Come join the masterclass. It's free, it's live, you'll be able to ask questions, and it's a lot of fun. Okay, so here's a 3-part framework to think about using supplements and how to be more strategic around them. Firstly, when I'm talking about supplements, you have to remember that supplements are just that. They are a supplement to health-promoting behaviors. They are not a replacement for things like lifestyle, for a healthy diet, for exercise, for getting enough sleep, and so on. They're an adjunct and not a replacement. But the 3 categories in which I think about supplements are we using them for prevention, are we using them for repletion, or are we using them as a therapeutic? So in the category of prevention, this includes things like using folic acid during pregnancy to prevent neural tube defects, or using vitamin D in older adults to prevent osteoporosis. In the category of repletion, are we using supplements to treat a deficiency or an insufficiency? For example, are we treating a vitamin D deficiency? Are we using iron to replete iron deficiency anemia? And this is particularly relevant to patients who are struggling with restless leg syndrome or restless sleep in general. Are we using melatonin in the context of a beta blocker, which can deplete melatonin levels? So in this category, we're thinking about, are we using the supplement to replete a micronutrient or mineral or an amino acid or something that might be deficient or insufficient in that patient? And then the 3rd category is, are we using the supplement as a therapeutic? So here again, with the example of melatonin, we may be using melatonin as a circadian rhythm regulator or a body clock regulator. And so there's a strategy around dosing and timing when we're using it in that way as a therapeutic. Or maybe we're using an omega-3 to reduce inflammation. In integrative psychiatry and in sleep, we might be using something like L-theanine to reduce anxiety and to reduce hyperarousal. Or we might be using something like an adaptogen. This includes herbs and botanicals that help regulate the nervous system. So for example, something like ashwagandha, which we're going to talk about during the sleep supplements webinar in more detail. So something like this might be used for nervous system regulation to help regulate cortisol levels, to regulate the HPA axis, and so on. So this is the category of using it as a therapeutic, which is a different strategy than using it for repletion or using it for prevention. Right? So those are the 3 categories that I think about supplements in: prevention, repletion, and as a therapeutic. So if this was helpful for you, go ahead and click the like button, and then go ahead and sign up for my free Sleep Supplements Masterclass. We're going to talk in more detail about supplements and how to use them strategically and how to really think about them in an evidence-based manner. I'm also going to share more about the Clinical Sleep Kit program, which is opening up in June, and it's a lot of fun. We've got a great community of doctors in there. We have monthly case conference. We've got deep dive trainings into different aspects of clinical sleep medicine. So it's a great way for you to learn about sleep medicine without having to go and do a full fellowship, because all of our patients have to sleep and we really do need this knowledge knowledge to better support them. So come join the Sleep Supplements Masterclass to learn more, and then I'll be sharing more about the Clinical Sleep Kit program then as well. I would love to see you there.